Next topic is bone tumor. So bone tumor has enacting stage. So in benign, it is latent low grade, high grade or aggressive metastasis. Intracompartmental tumor grows within the bone. Extracompartmental is tumor goes behind the bone and soft tissue. Okay. Now the benign bone tumor. So benign bone tumor, we have mnemonic 4O and gas. What is 4O and gas? Osteoblastoma, osteochondroma, osteoidostoma, giant cell tumor, aneurysmal bone cyst, and simple bone cyst. Okay. Malignant bone tumor. So malignant bone tumor, chair to chest. What is chair to chest? Chordoma, adamentinoma, osteosarcoma, chondrosarcoma, ing sarcoma. Now the tumor which has diphyseal origin of bone tumor, fibrous dysplasia, adamentinoma, osteoidostoma, ring sarcoma. Metaphyseal origin of bone tumor, OO anu, osteochondroma, osteosarcoma, aneurysmal bone cyst, non-ossifying fibroblastoma, unicumeral bone cyst. So this is the humerus. So this is diaphysis. There are tumor which originate from diaphysis, tumor which originate from the metaphysis. Okay, so these have different location. Pulsatile bone tumor, Goa-Marant is giant cell tumor, osteosarcoma, aneurysmal bone cyst, and the metastasis from renal and thyroid. Okay. Now the different age group have different most common tumor: 5 to 25 year Ewing sarcoma, 10 to 20 year primary osteosarcoma, 20 to 40 giant cell tumor, 40 to 60 year chondrosarcoma, and 60 year multiple myeloma. So all you have to mug up. You can't do anything in bone tumors. It is very important in NEET PG exam as well as in final year of MBBS. So you have to remember all these. Okay, but these are the mnemonic which helps you in remembering. Okay. Now the most common benign tumor is osteochondroma. Most common true benign tumor is osteoidostoma. Malignant bone tumor is metastasis. There is very less, you will very less frequently find oncology on bone tumor in orthopedics OPD. Most common malignant bone tumor, metastasis, primary malignant bone tumor, multiple myeloma. Shepard-Crook deformity seen as fibrous cortical dysplasia. Trapdoor sign, fallen fragment sign seen in simple bone cyst. Onion peel appearance, wing sarcoma. Osteosarcoma is sunburst appearance. Codman triangle is seen in osteosarcoma. So these are the striking features of all tumors. So I have compiled in a single. I have compiled it. Okay. So polka dot sign, it is seen in hemangioma on CT. Soap bubble appearance, GCT, egg cell cracking, GCT. So now benign tumor. So in benign tumor, so to diagnose any tumor, you have to remember 1 to 2 things. Of each tumor, you can diagnose any tumor. So in fibrous dysplasia, it is Shepard-Crook deformity, distal femur, and the metaphyseous. It is originate from distal femur, metaphyseal origin. It is developmental anomaly. X-ray shows ground glass appearance, lucency and haziness. Rind sign, what is dense sclerotic area around the lucency. Associated syndrome, polystotic, fibrous dysplasia, pigmentation, precocious puberty. Okay. Now, Mesobrod syndrome, it is polystotic fibrous dysplasia, intramural muscular myxoma. Most common site is distal femur, biopsy by Chinese letter sign. Okay. Now there is a difference between simple bone cyst and aneurysmal bone cyst. Simple bone cyst originate from metadiaphyseal area. Cyst is so clear flowed and unilocular. Aneurysmal bone cyst has metaphyseal origin, contains blood with giant cell. Okay. So simple bone cyst, how will you treat? By excision and curettage, trapdoor sign sees, fallen fragment sign sees, extended curettage you have to do. Osteochondroma seen in young kids like 18 year of age patient, originate from distal femur. You can see this is a osteochondroma. We used to operate these patients in residency. Cause of pain is bursitis, large to feel, small on X-ray. So if you feel this, then it is large to feel, and when you take the X-ray, it is very small. Cause of pain is bursitis, hereditary multiple exostosis, 5% progress to chondrosarcoma. In chondroma, it is most common tumor of hand, arises from medullary cavity. Okay, in chondroma. Olliers disease, it is multiple in chondroma. Maffucci syndrome, multiple in chondroma plus cavernous hemangioma. Okay. Now, chondroblastoma. What is chondroblastoma? It is Codman tumor. X-ray shows stippled calcification. Biopsy, chicken wire calcification. Okay. These are all the features of chondroblastoma. You will find in chondroblastoma, chicken wire calcification, stippled calcification. Originate from distal femur. Treatment by excision and curettage. Now the osteoidostoma, it is the true benign tumor. It is true benign tumor. Originate from diaphyseal origin. Patient will present with night pain. This is the characteristic feature and relieved by NSAID. Okay. This releases prostaglandins. It is relieved by taking analgesics. Management by radiofrequency ablation. GCT, giant cell tumor, most common site of origin is distal femur, then distal radius, eccentric origin, first most commonly seen in females. Okay. Patient with present with XL cracking, soap bubble appearance, biopsy show multinucleated giant cell, treatment by extended curettage, liquid nitrogen, bone cement, phenol, the hemangioma, CT scan, so polka dot sign. So in hemangioma, you will find the polka dot sign on CT scan. So I'm just telling you that I can understand it is very boring to remember all these, but you have to remember 1 to 2 clinical striking features in bone tumor of each bone tumor, so you can diagnose the disease. They will not directly ask you कि ये features हैं आप बताओ ये क्या है. They will not directly ask you. They will give you the like a patient who has trapped door sign on X-ray. Now what is the treatment of this bone tumor? So you have to understand, you have to remember that trapdoor sign is seen in simple bone cyst and the treatment is curettage. Okay, so you have to remember 1 or 2 things of each tumor which is striking of that tumor only. Okay, so osteochondroma, same with enchondroma seen is multiple bone tumor seen in phalanges. Okay, GCT you will find XL cracking, soap bubble appearance. Osteochondroma, it is the most common tumor in children in second decade. Primary and secondary. Primary is seen in 10 to 20 year of age. Secondary seen in old age. It is bone forming. It is radio resistant. It is radiation induced bone tumor. Okay. So Codman triangles. Triangle is elevated periosteum, and Codman triangle is also seen in Ewing sarcoma. So this is not a exclusive feature of osteosarcoma. Okay. It has metastasis to lung. Sunburst appearance. On X-ray, treatment is by chemotherapy. Then if it did not reduce, then we have to do amputation. Chondrosarcoma has popcorn appearance. Hyperglycemia is the paraneoplastic syndrome. And the chondrosarcoma is radio and chemo resistant. Management by surgery because it is radio resistant and chemo resistant. Wing sarcoma. Wing sarcoma is the most common tumor of first decade. Diphyseal origin, onion peel appearance on X-ray. 1122 translocation, MIC2 gene affected. Okay, chordoma, it is seen in sacrum. Phyceliferous cells of primitive notochord is the origin. Edemantinoma, it is diphyseal origin. Okay, soap bubble appearance, and the origin is in tibia. This is the edemantinoma. This is chondrosarcoma. Okay, so let's revise all these tumor. So fibrodysplasia, you will find sapphire crook deformity. Okay, simple bone cyst, trapdoor sign. Osteochondroma, origin in distal femur, large to feel, small on X-rays. Enchondroma, tumor of phalanges, small bones. Okay, chondroblastoma, stippled calcification, chicken wire calcification. Osteodyostoma, diphyseal origin, pain relieved on by NSAIDs. GCT, females में common है, most common site distal femur, then distal radius. XL cracking, soap bubble appearance. Hemangioma, polka dot sign on CT. Malignant tumor, osteosarcoma is bone forming tumor, it is radio resistant. Okay, radiation induced osteosarcoma, Codman triangle, elevated periosteum, sunburst appearance. Treatment is by chemotherapy, then amputation. Chondrosarcoma, we have understood about the popcorn appearance and hyperglycemia seen. Wing sarcoma seen in first decade. Onion peel appearance, 1122 translocation. Chordoma seen in sacrum. Edemantinoma has soap bubble appearance. Okay, now there are characteristic of secondaries. Malignant cell, purely blastic is prostate, carcinoid and medulloblastoma. Purely lytic is kidney and thyroid. Breast, in breast you will find mixed lytic and mixed. Okay, now the bone infection. Infection can be anywhere. So if it is in bone, then it is known as osteomyelitis. It is infection of bone. And if the infection in joint, then it is septic arthritis. Most common route is hematogenous. Now osteomyelitis can be from anywhere. So if it is due to human bite, so it is the echinella which is causing the osteomyelitis. Chronic osteomyelitis is the most common complication of acute osteomyelitis. Femur bone, it is the most common bone involved in children in osteomyelitis. Metaphyseus is the most common location for osteomyelitis. Pasteurella, it is the animal bite which is causing the osteomyelitis. Hematogenous route is the most common route for acute osteomyelitis. Okay. So Staph aureus is most common organism. Now metaphysis of bone, in fact femur is affected. Metaphysis of bone is affected in osteomyelitis. In infant, femur is affected. In adult, vertebra is affected. Metaphysis has hairpin loop structure because it is most vascular. Periosteum synthesis newborn. In this is periosteal reaction. MRI, you will find on MRI the earliest. Okay, bone scan can also be used, but gold standard is biopsy. Now in sickle cell patients, salmonella is the most common organism. So you can remember S is for S, acute osteomyelitis before the formation of sequestrum, chronic osteomyelitis after the formation of sequestrum. Okay, so WBC is increased, ESR and CRP is raised in chronic osteomyelitis. So what is the complication of osteomyelitis? Chronic osteomyelitis. Acute osteomyelitis, patient will present with fever and pain. So what is the hallmark of chronic osteomyelitis? Formation of sinus and sequestrum. Sequestrum is hallmark. Sinus can be seen in TB. That's why sequestrum is hallmark. So it is very difficult to treat osteomyelitis. That's why in orthopedics operations we used to maintain sterility, because if it infects, if it is infection goes in bone, then it is very difficult to treat. So osteomyelitis treatment is very tedious. Many times it did not go for years. Okay, sequestrum. What is sequestrum? It is dead bone separated from the normal bone. Treatment is sequestromy. Involucrum, newborn formation. So these are the terms which asked in exam. Cloaca is opening in involucrum. So sequestrum is dead bone. Formation of new bone around the sequestrum is involucrum, and opening in involucrum is cloaca. So gold standard is biopsy. I have already explained. And MRI, obviously, it is the costly investigation. It is earliest to diagnose. Less than 2 weeks, it is known as osteomyelitis acute. 2 to 4 weeks subacute, and greater than 4 weeks it is chronic. So there are various types of sequestrum. BU is for buttonhole sequestrum, R is for radiation sequestrum. Burak cough 5 quote coca tapkaria hai. I know this mnemonic has no sense, but it covers the all type of sequestrum. Fine sand is seen in viral osteomyelitis. Cork sequestrum is seen in cancellous bone. Tubular sequestrum is seen in pyogenic osteomyelitis. Okay, so what is the treatment of chronic osteomyelitis? Sequestromy, debridement, and curettage. Next is Brody's abscess. So Brody's abscess is localized subacute osteomyelitis. Long bone tibia is involved. Patient will present with intermittent pain, local tenderness. X-ray shows lytic lesion. Sclerotic rim, Staphylococcus aureus is seen in 50% of patients. So these are different type of osteomyelitis. Gary osteomyelitis, active periosteum proliferation, formation of subperiosteal bone, no purulent exudate. Okay. Now the septic arthritis. Septic arthritis is infection of joint. We have learned about the infection of bone is osteomyelitis. Infection of joint is septic arthritis. Okay. So what is osteomyelitis? So osteomyelitis is infection of bone. So now in infection of bone, it could be acute. So if it is less than. So the Pasteurella infection is animal bite. So if animal bite is causing the osteomyelitis, so most common organism is Pasteurella. Okay, hematogenous route is the most common route for osteomyelitis. Okay, so we have learned about these. We have learned about the Gary osteomyelitis, septic arthritis. Now in septic arthritis, there is a Thomas Smith arthritis. It is septic hip in infants. Okay, transient synovitis of hip. It is a self-limiting infection of hip. It is mimic the Tom Smith, but it is not actually the infection. Okay, it is the irritation in hip. Now next is TB. So TB most commonly it involves the vertebra. It is known as pot spine. Most common is paradiscal type. Earliest symptom is pain. Investigation of choice is MRI. Complication is Pott's paraplegia. Treatment is middle path regime by ATT. TB hip stage. Synovitis. Second is early arthritis, late arthritis, wandering acetabulum, fibrous ankylosis. Okay, so these are the stages of TB in hip. Okay.